London, a health official said the Delta variant of COVID-19 continues as the dominant strain of coronavirus and marked a sharp increase in the UK with more cases logged on Friday, which marks a 32% increase over the previous week. Public Health England, PHI, said its weekly analysis shows the continued rise in infections is not followed by a similar increase in hospitalizations and deaths, which reflects a high protection offered by both doses of a coronavirus vaccine. In a separate study, PHI also found that all the vaccines being administered are as effective at preventing symptomatic disease in the majority of people with underlying health conditions as the rest of the population. The data continues to show that the sharp increase in cases that we are seeing is not being followed by a similar increase in hospitalization and death, said Drive Jenny Harries, chief executive of the UK Health Security Agency. This is because 2 doses of the available vaccines offer a high level of protection against the Delta variant. Getting both jabs is the best way to ensure you and the people you love remain safe, so we once again urge everyone to come forward as soon as they are eligible, she said. As we approach the planned end of restrictions, we must remain cautious and careful. Cases are rising across the country, and whilst the vaccines offer excellent protection, they do not offer 100% protection, she added. The weekly PHI data found the Delta A1 sublineage, so-called Delta Plus mutation for its feared vaccine resistance, remains low at 44 cases. Overall, the Delta variant first identified in India currently accounts for approximately 99% of cases that are sequenced across the UK, followed by the local Alpha variant of concern. In a variant technical briefing, PHI revealed that secondary attack rates the likelihood of an infection occurring in a given context amongst household contacts of cases with Delta has continued to fall. Despite this continued fall, secondary attack rates for both household and non-household contacts of cases with Delta remain higher than for Alpha. In its separate vaccine study, PHI found overall vaccine effectiveness against symptomatic disease in risk groups at approximately 60% after 1 dose of either Oxford AstraZeneca Covishield or Pfizer/BioNTech, with little variation by age. After 2 doses, vaccine effectiveness is 81% with Oxford/AstraZeneca in people in risk groups aged 16 to 64. No data is available for both doses of Pfizer/BioNTech yet. Diabetes, severe asthma, chronic heart disease, chronic kidney disease, chronic liver disease, neurological disease, and diseases are therapies that weaken the immune system such as blood cancer, HIV or chemotherapy have all been linked to an increased risk of hospitalization or death with COVID-19. This real-world data shows for the first time that most people who are clinically vulnerable to COVID-19 still receive high levels of protection after 2 doses of vaccine, said Drive Mary Ramsey, head of immunization at PHI. It is vital that anyone with an underlying condition gets both doses, especially people with weakened immune systems as they gain so much more benefit from the second dose, she said. The UK government is to confirm on Monday its plans to end all legal restrictions in the country from July 19. Doctors and medical leaders have been calling on the government to keep some measures, such as face masks in indoor settings, in place as the infections continue to rise. In a statement, the Academy of Medical Royal Colleges, which represents 23 medical bodies responsible for training and development in various specialties, said it was essential that people took a responsible approach when restrictions were formally lifted. It warned that there was little doubt that things will get worse before they get better. The warning comes as the UK logged daily coronavirus cases on Friday, the highest daily figure this year since January 22. Adblock Test Y.